Assalamu alaikum and hello and welcome to Babystepmed, where I try and make difficult medical concepts a bit easier. In this video, I'm going to be talking about blood products. There's a lot of confusion and different things, but I'm just going to give you really high yield stuff that's going to help you a lot, inshallah. So let's talk about blood products. There are three kinds of blood products. There's whole blood. There's products made from the blood by centrifuging it, and then there are some other things. So first of all, basically, if somebody is volume depleted, basically you're going to give them IV fluids. Okay, but we are not talking about that. We're talking about blood products. Okay, so the first scenario is hemorrhage. Okay, so the preferred thing is whole blood. Okay, that is what you absolutely prefer in all kinds of situations. But in situations like emergency situations, you don't really have this on hand, so you go for blood products. And what do you exactly give? Oh, I forgot something. Let me add it in. Okay, so these are all the available options. You have fresh frozen plasma, platelets, cryoprecipitate, and packed red blood cells. So if somebody has a hemorrhage, what do you give them? You don't just give them packed red cells. How do you give stuff? So you give them three things. You give them fresh frozen plasma, you give them platelets, and you give them packed red blood cells in this ratio. So you give them all three things, 1:1:1. Okay, so you give everything in equal amounts, and then till the time you can get your hands on some whole blood, and then you give them whole blood. Okay, so that's that. Next up, I'm going to talk about when do you give fresh frozen plasma. You give these for coagulopathies, and you give them for warfarin toxicity. Okay, when do you give platelets? So you transfuse platelets if somebody has less than 10K platelets, because they're at an increased risk of spontaneous bleeding. So you go ahead and give them platelets. Or if somebody has less than 50K platelets, 50K is 50,000, and they're bleeding. If they're actively bleeding and they have really less platelets, then you go ahead and give them platelets. Next, we're going to talk about cryoprecipitate. Cryoprecipitate is just basically a concentrate of coagulation factors, and these include fibrinogen and von Willebrand factor and factor 8 and factor 13. You give this if somebody has decreased fibrinogen, or if they have von Willebrand disease, or if somebody has been given a lot of anticoagulants and you need to reverse that. So you go ahead and give them cryoprecipitate. Next up, we have others. So there's a transemic acid. How do you spell this? Transemic acid, I think. If this is wrong, I'm sorry. I just can't recall the spelling right now. Other than that, you give them topical. Wait, just let me make some space here. You give them topical hemostatic agents. These include a kaolin soaked sponge or fibrin sealant dressings. So these are just add-ons, and they can help if somebody is actively bleeding and you just really need to stop them from bleeding out. So that was the really quick high yield video. I hope that you understand this, and this is just like really simple to understand. I haven't got into the details of how you get each and everything and the nitty-gritties. This is just the bang high yield stuff that you definitely need to know, and it's also going to help you answer a lot of questions, because they might give you different scenarios like, oh, a patient has they're completely fine and everything, and they have a platelet of anything, what should you do? And you know, if you just like memorize everything that I just said here, you'll be good, inshallah. Okay, so I'm really sorry for the bad writing, but yeah, thank you for watching. Please like and subscribe, and bye.